In the animal kingdom, you're either the hunter or the hunted, and in the human world, things aren't much different. The tilt of your eyes play a major role in determining your place in the food chain. A positive Canthal tilt gives you a fierce and focused look, while the negative one can make you appear exhausted and defeated. Don't worry though, there are several Looxmaxing ways to improve your Canthal tilt, and we're going to cover them all in this video. To find out your current tilt, all you need to do is compare the height of your eye's outer corner to the inner corner. Let's talk more about the Canthal tilt, or the angle between the outer and inner corners of your eyes. The Canthal tilt measures the vertical position of the inner and outer corners of your eyes. The inner corner is called the medial canthus, while the outer corner is the lateral canthus. Simply put, the Canthal tilt is the angle of the outside corner of your eye in relation to the inside corner. You can easily see how it's measured by checking out the line in this photo. There are 3 types of Canthal tilts: positive, negative, and neutral, and each type can have a significant impact on your appearance. The most desirable Canthal tilt is a positive one, which occurs when the medial canthus is 4 to 8 degrees below the lateral canthus. This means the outer corner of your eye is slightly higher on your face than the inner corner, giving you an alert and youthful look. On the other hand, a negative Canthal tilt, where the lateral canthus is lower than the medial canthus, is generally seen as less attractive. A neutral Canthal tilt, where the 2 corners are on the same horizontal line, is a less common but still valid option. A neutral Canthal tilt is the most common and generally considered aesthetically pleasing, where the inner and outer corners of the eyes are vertically aligned. It's a versatile look that works for most people, and Ian Somerhalder is a great example of this. His eyes look amazing with a neutral Canthal tilt. While he doesn't have hunter eyes, his horizontally elongated, deep-set eyes with minimal upper eyelid exposure are undeniably attractive. And let's not forget his killer eyebrows and eyelashes. They really tie the look together. Plus, he's a pro at squinting. It's like he's always gazing off into the sunset, even when he's just reading his lines. A little positive tilt can do wonders for your eyes, making them look more exotic and even more attractive. This happens when the outer corner of the eye is higher than the inner corner. Positive Canthal tilts help people look alert and awake, not to mention more youthful. Also, while having a downward pointing medial canthus can enhance a positive tilted eyes, it's not a magical fix for an overall bad face or eye area. As proof, let's take a look at this man with a desirable downward pointing medial canthus, but still falls below average in the eye department. So, don't rely on this feature alone to improve your looks. Finally, there is negative Canthal tilt, which is when the medial canthus or the inner corner of the eye is higher than the lateral canthus or the outer corner. This feature is generally unattractive, giving the eyes a sagging, droopy appearance. As we discussed in the previous episodes, the image on the left with negative Canthal tilt makes the face look tired and worn out, while the image on the right with a positive Canthal tilt is more harmonious with the face's other features. It's easy to see why negative Canthal tilt is so unappealing. It can make someone look constantly worried, scared, or frightened, sending all the wrong signals. That's why having a negative Canthal tilt is going to make it nearly impossible to achieve those highly sought after hunter eyes. To drive home the point, just look at these examples. Even though the first set of eyes seems good overall, the negative Canthal tilt completely ruins his chances of having hunter eyes. And in the second example, the man's attractive features quickly fade away when you see his negative Canthal tilt. So, if you have a negative Canthal tilt, it can bring down your appearance, making you look tired, sad, and old before you even say a word. Don't overlook the importance of this crucial feature. The Canthal tilt is a crucial factor in determining a person's attractiveness. Researchers have found that modifying a woman's medial Canthal tilt in photos to make it more positive significantly increased their attractiveness. This study just shows how big of a difference having a positive canthal tilt can make. For men, having a positive canthal tilt can be a major advantage. This is especially true for those who want to achieve the highly coveted hunter eyes look, which is all about having a positive canthal tilt. For guys, a negative canthal tilt can give off a sleepy and unresponsive vibe, the opposite of the piercing and intimidating hunter eyes that are often preferred by women. However, an overly positive canthal tilt can also be problematic, as it can make you look a bit alien-like or unusual, possibly due to associations with developmental disorders. Both extremes are generally unattractive. To solve this, some plastic surgeons suggest that men should aim for canthal tilt of no more than 1 to 2 degrees, while women can aim for 3 to 4 degrees. Personally, I think a canthal tilt of 4 to 6 degrees is ideal for men. A positive canthal tilt is attractive in women too. In a study, 93% of people preferred women with a positive canthal tilt. It turns out that this feature is more common in individuals with particularly attractive faces, including beauty competition winners. Interestingly, a positive canthal tilt is thought to be especially appealing in females because it's a neotenous, childlike trait that's more pronounced in infants. Unfortunately, as the tendons and ligaments around the canthus weaken with age, the eye often begins to shift to a negative canthal tilt. And because a negative canthal tilt is often associated with facial aging, it's particularly harmful to female facial attractiveness. Canthal tilt is also mildly sexually dimorphic. In fact, women are more likely to have upward slanting eyes than men, especially among Caucasians. Interestingly, a positive canthal tilt is more common among East Asians, but among females, the most attractive faces have a less pronounced positive canthal tilt than what is typical for that population. The situation is reversed for female Caucasians and Africans, whose attractive faces are more likely to have a pronounced positive canthal tilt. But the masculine and feminine versions of positive canthal tilt are not the same. Men have a neutral lateral canthus and a long, defined and downswinging medial canthus, which gives them a positive canthal tilt. A man's lower eyelids should be straight and angular, while a woman's lower eyelids are curved and round. In terms of eye area, a man's medial canthus that points down is one of the most dimorphic features. Here are some good examples of what I mean by long, defined, and downswinging medial canthus. Positive canthal tilt in women is caused by an upswing lateral canthus, as evidenced by this pic. A woman's lower eyelid is curved and has a round shape. Lower eyelids that are rounded are more feminine. Here is an example of a woman with a typical positive canthal tilt in which the inner canthus is straight and the outer canthus is curved up. Notice that their lower eyelids are all round and curved, and that their outer canthus curves up. This is what gives them their feminine positive canthal tilt. Here's a man with the ideal positive canthal tilt for a man. On the right is a man with a positive canthal tilt that is more common in women than in men. As you can see, both groups of men have positive canthal tilt, but what causes positive canthal tilt is different for each group. Look at the differences between the two pictures of the men's lower eyelid straightness, angularity, and overall shape. Notice how their inner canthus and outer canthus are different. Now, you might have heard some misconceptions floating around in this space, so let's clear things up. Some people think that a negative hooding is the same as a negative canthal tilt, and they assume that the tilt of the eye hooding is linked to the tilt of the eyes. But here's the thing. The canthal tilt and outer hooding angle aren't related. It's common for people to confuse canthal tilt with eye hooding tilt. But trust us, the hooding tilt isn't correlated with the canthal tilt. Believe it or not, I've seen people get it wrong time and time again, thinking that negative hooding is the same as negative canthal tilt. But in reality, this is positive canthal tilt with negative hooding. Take a look at this pic. The hooding is pretty negative, but the eyes are actually still positively tilted. The upper eyelid and upper eyelashes are both overarching, and the orbitals are positively tilted. So what really causes a negative canthal tilt? Well, in most cases, it's due to aging, droopy, and swollen eyelid skin. The weight of the extra skin in that area can weigh down the outer corners of your eyes and bring them down. In most cases, it's genetics. If your parents have a negative canthal tilt, you might have inherited it from them. Lack of bone support under your eye area can also cause a negative canthal tilt, especially if you're a mouth breather. When your tongue rests at the bottom of your mouth, it can cause your canthal tilt to worsen over time. Additionally, external factors like smoking can speed up the skin's aging process and decrease its elasticity, leading to droopier eyes at the outer corners. In our eye deep setness video, we touched upon the importance of the orbital vector. A negative canthal tilt can also be caused by a negative orbital vector. Take a look at this image of a negative orbital vector. The anterior globe sits forward of the lower eyelid margin, which in turn sits forward of the malar eminence. So, now, before we jump into the exciting part of learning how to fix your negative canthal tilt, let's first explore how you can measure your canthal tilt. It's important to understand your starting point before making any improvements. Measuring your canthal tilt is easy and can be done in a few simple steps. To check if you have a positive canthal tilt, take note if the lateral canthus is 5 to 8 degrees higher than the medial canthus. For a neutral canthal tilt, there won't be any angle between the two canthus. However, if the corners of your eyes droop down, you might have a negative canthal tilt, which is the opposite of what you want. To measure, stand in front of a mirror and look directly into your eyes with a relaxed head position. You can also take a photo staring straight into the camera with a relaxed head position. But be careful not to look up or down, as this can affect the appearance of your canthal tilt. After taking a photo, draw a line from your lateral to medial canthus on both eyes. If your lateral canthus is higher than your medial canthus, you have a positive canthal tilt, and the lines will create a slight V shape. For a neutral canthal tilt, you'll see a straight line with no angle. And if you have a negative canthal tilt, the lines will droop downwards from your medial canthus to your lateral canthus, creating an inverted V shape. Alright, let's get to the good stuff that you've all been waiting for. How can you Looxmax your way from a negative canthal tilt to a neutral or even positive one? Remember earlier we talked about how a negative canthal tilt can result from a lack of bone support under your eyes? This often happens when you have improper tongue posture and a poorly developed midface. If your tongue doesn't rest on your palate, your midface won't get the stimulation it needs. Luckily, mewing can help correct your tongue posture and move your midface up and forward, which can improve your canthal tilt. Mewing also has the added benefit of moving your cheekbones up and forward, which provides more support to your eye area. The only downside is that this method works best while you're still growing, and even then, it can take months or years to see results. If you're an adult, it may take years or even decades to make any significant changes. So, after weighing the pros and cons, I've come to a conclusion. Mewing belongs in the cope tier. If you're here watching this video about how to fix negative canthal tilt, you've probably heard of eye exercises. They're a great way to tone and strengthen the muscles around your eyes, which can help improve their appearance. Check out this popular lady's tips for lifting up your canthal tilt. They seem worth a try, right? Of course, there's no scientific evidence to back this up, and basic anatomy suggests that it's impossible. But some people swear by it, so why not give it a shot? Simply place your index finger on the outer corners of your eyes and apply gentle upward pressure while squinting. It's easy and harmless. Plus, this lady has 214,000 subscribers for a reason, so there must be something to it. We all know that nothing beats surgery, but sometimes small measures can make a difference. Canthal tilt correction surgery is a cosmetic procedure that can help to improve negative canthal tilt. There are several different techniques that can be used for canthal tilt correction, depending on the specific needs of the patient. One common technique is the lateral canthoplasty, which involves shortening and tightening the lower eyelid to create a more upward tilt. Another technique is the canthopexy, which involves repositioning the lower eyelid without shortening it. In some cases, both techniques may be used together to achieve the desired result. Canthoplasty is a procedure where the tendon or substance of the lower eyelid is modified, whereas canthopexy involves securing the eyelid muscle or tendon by folding it on itself. The former is more powerful, but it can also change the position of the canthus and the slant of the lid. On the other hand, canthopexy is less powerful, so it results in less change in appearance. Canthal tilt correction surgery is typically performed under local anesthesia with sedation and can take anywhere from 30 minutes to an hour to complete. The procedure involves making an incision at the outer corner of the eye and lifting the tissues to create a more upward tilt. Recovery time can vary depending on the extent of the surgery, but most patients can expect to return to normal activities within 1 to 2 weeks. It's important to discuss the risks and benefits of canthal tilt correction surgery with a qualified plastic surgeon before making a decision. Some potential risks of the procedure include bleeding, infection, scarring, and changes in vision. If you're considering surgery, it's important to keep in mind that it would involve changing your natural anatomy. If you are in your teens and early 20s, I would suggest waiting since your face is still changing and developing. It's best to allow for those changes to occur before making any major decisions. Plus, the surgery itself would be quite involved and difficult to reverse, so it's important to be well informed and make the decision at the right time. Moreover, some eye surgeries give a fake and unnatural look. Specifically, we'll focus on canthoplasty or lower eyelid retraction surgery. You know what I mean? The Melania Trump look that just doesn't seem right. Let me show you an example. Take a look at the lower eyelid. See how it looks weird and unnatural? Unfortunately, this look isn't uncommon, and there are more examples like this out there. Now, some people might say that an eyelid is too high or covers too much from the lateral scleral triangle, but I don't necessarily think that's the case. Even if we just compare the lower eyelid to natural eyelid shapes with higher lower eyes, the surgery results still look more unnatural. Maybe it's just a psychological thing, but I have another theory. Let's take a closer look at what factors determine our eye shape. Eye prominence, tone, and position of the lateral anchoring tendon all play a part, and of course, bones are a big factor too. Here's what I noticed. People with deep-set eyes often have a very high lower eyelid, and the protruding of the eyeball has a significant impact on the shape of the upper eyelid. So, if you just change the lower eyelid and don't touch the eye protrusion, which affects the appearance of the upper eyelid, the relation between the two lids might look off. In these cases, orbital decompression and lower eyelid work might be necessary. Or maybe the lower eyelid in the surgery result is just too straight. The unnatural look is created because while the lower eyelid becomes tighter and comes closer to the eye pupil, the upper eyelid remains distant and unchanged. It gives a Nicolas Cage, you don't say, unnatural, tense expression, instead of shortening the eyelid, which can actually make things worse. The solution is to lengthen the lower eyelid in both a horizontal and vertical dimension. To give you the best advice, an in-person exam is necessary. However, for your eyes, I wouldn't suggest undergoing any surgery, especially if the negative canthal tilt is mild, since it's almost imperceptible to 99.9% of people. Plus, fixing it could lead to more surgeries if it's not perfect. I would not feed into your body dysmorphia. I think it's best to avoid surgery altogether. Now, there are non-surgical options to fix a negative canthal tilt. Dermal fillers and Botox can be super effective in addressing the underlying muscular and structural issues that cause the downward slope of the outer corner of the eye. Let's talk about dermal fillers first. They are made up of hyaluronic acid, which is a natural substance that helps to hydrate and plump the skin. by injecting them into the upper outer corner of the eye. Fillers can add volume and lift to the area, giving your eyes a more positive canthal tilt. Botox, on the other hand, is a neurotoxin that works by relaxing the muscles that cause wrinkles and lines. When injected into the muscles that pull down the outer corner of the eye, Botox weakens their action, allowing the muscles that lift the eye to work more effectively. This results in a more positive canthal tilt. The best part is that both of these options are non-surgical, meaning you can get them done quickly and with minimal downtime. However, keep in mind that these treatments are temporary and will require maintenance over time to keep their effects. It's important to note that fillers and Botox aren't suitable for everyone, so it's best to consult with a qualified medical professional to see if these treatments are right for you. Also, keep in mind that while they can be effective in improving a negative canthal tilt, they may not give you the same level of results as surgical options. When you take a photo from a downward angle, it can create the illusion of a negative canthal tilt, where the outer corner of your eye slopes downwards, giving you a tired or sad look. However, taking a photo from an above angle can make your eyes appear brighter and more lifted, giving you a more positive or neutral canthal tilt. If you want to test the angle of your canthal tilt, try taking pictures of your face from different angles and compare the results. This is a great way to figure out which angle works best for you, and how you can achieve a more positive canthal tilt in your photos. If you're looking to improve your appearance and boost your masculinity, shaping your eyebrows is a great place to start. In my opinion, maxing out your eyebrows and shaping them to a more positive shape is the best way to counter a negative canthal tilt failure. And here's a little secret. Negative eyebrow tilt is even worse than negative canthal tilt. Just take a look at Brett Maverick. He has a noticeable negative canthal tilt, yet his positively tilted eyebrows give him a dominant, masculine, and alpha appearance. But if your eyebrows are negatively tilted, it can give you a worried, harmless, innocent beta look, even if all your other features are Chad tier. So, I would argue that negatively tilted eyebrows are even worse for your masculine, dominant appearance and social status than mild negative canthal tilt. Of course, negative canthal tilt can still be one of the most unattractive traits, but only when it's bad enough. The good news is that positive, dark and low set eyebrows are some of the best eye area features, and it's actually pretty easy to shape your eyebrows that way. You can get an eyebrow transplant or follow a growth protocol to make your eyebrows fuller. And make sure you watch my video on how to get ideal eyebrows for men, where I go over many ways to grow your eyebrows. However, it's best to seek an expert's help when shaping your eyebrows, as doing it on your own can mess things up. Also, let's not forget that having light-colored eyes can improve your facial harmony. Light-colored eyes can give your look some serious pop and make you appear more intriguing and lively. Light blue, green, hazel. These are the eye colors that everyone desires. But even light brown eyes can give you a boost compared to very dark brown eyes. Just look at Jeremy Meeks and how his light blue eyes skyrocketed his fame. Now, the good news is that getting your dream eye color is super easy with the right contacts. All you need to do is select the perfect shade for your skin tone and ethnicity and find the most realistic looking pair. And guess what? I have a comprehensive PDF guide that covers everything you need to know about colored contacts. And the best part? It's absolutely free. You can find the download link in the description below. And with that, we're wrapping up this episode. But before we go, remember to give this video some love by hitting that like button. And if you found this information helpful, drop your thoughts in the comments below. Your feedback means everything to me, and it also helps the YouTube algorithm, so I can continue to create content just for you.